Hello and welcome to this session of our Impact Forum 2021. The Centre for Homelessness Impact works to collect evidence and data on proven ways to end homelessness, and we do this across all parts of the United Kingdom. So today we're delighted to have a session focusing on this work, the work to end homelessness in Northern Ireland. And I'm delighted to say we'll have a panel of experts to discuss this. First of all, we're going to hear in just a moment from the Minister for Communities in Northern Ireland, Deirdre Hargey. I'm just going to say before we do a little word about how this will work. We'll hear from the Minister, then we'll hear from each of our panelists who I'll introduce in turn when they come to speak. And after that, we'll have a short discussion among the panel, and then we'd like to take your questions. So please do put any questions you have to members of the panel in the chat, and I'll pick them out, or panelists will pick them up as we go. So thank you very much for joining us. And now we're going to hear from the Minister for Communities in Northern Ireland, Deirdre Hargey.
I'm delighted to have the opportunity to address you all today as part of this Impact Forum. Addressing homelessness is a key priority. It has many challenges that have been exacerbated by COVID-19 crisis. It is my belief that a home is vital for the well-being of any person. Access to a safe, decent, affordable place to live is a fundamental right, the foundation for a productive and fulfilled life, and the basis for communities and society. I have set the challenge out to my officials and the Housing Executive. Homelessness should be as rare as possible, as short as possible, and reoccur as seldom as possible. I firstly want to talk about the immediate challenges we have faced due to the pandemic. Over the coronavirus emergency period, we implemented a public health response to protect those who are homeless. For example, to allow social distancing, the Housing Executive added 700 more temporary accommodation units, including a pop-up hostel at Farset. In addition, the Housing Executive Department and the homelessness sector worked really closely with public health and coordinated a response, including guidance, testing, vaccination arrangements, and operating protocols to respond to COVID-19 outbreaks in homeless settings. I'm very proud of this work and glad it was recognised at a recent Housing Awards, and want to thank everyone who was involved. From April 2020, homelessness trends changed compared to the previous years. The impact of the lockdown restrictions over the past year was evident, with increases in sharing breakdown, family dispute, neighbourhood harassment, and relationship breakdown. In terms of the scale of homelessness, moving on and to the longer term issues, last year 17,000 households presented as homeless, and around 2/3 of these were accepted as full duty applicants. The number of people accepted as full duty applicants continue to creep up, as does the number of people in housing stress. The last street counts in November last year identified a total of 18 people sleeping on the street, a significant decrease from the year before. Although many of you will be aware that the use of a very specific methodology, it does indicate that sleeping on the street is relatively low here compared to some other places. So we have plenty of work to do, and I just want to highlight some of the work that is going on and some of the changes I want to see happen. Firstly, we need to rebuild our homelessness service as we emerge from the pandemic, and the Housing Executive have adopted and coordinated a response to address the impacts of COVID-19 and has developed a reset plan to focus on rebuilding these services. Our focus remains on maintaining services and protecting the homelessness, but our attention has also begun to shift to post-COVID-19 planning and transition to a new normal. You will notice that this reset plan, we do not want to return to where we were before. We want to build back better and fairer. I have supported this by securing full funding for the plan this year with a £9 million allocation. One of our most significant programmes is the Supporting People programme, and I've continued to ring fence and protect this £73 million budget, while many other resource budgets have been reduced. The Supporting People programme provides a lifeline for many of our most vulnerable people, including homeless people. It is in this programme and in the excellent work of the Supporting People scheme providers that allows the many complex needs of those forced into homelessness to be addressed. And I will continue to protect this programme in a difficult resource context. One of the big lessons from the last year has been the value of closer frontline working with our health colleagues. And I would like to take the opportunity to acknowledge and thank the Public Health Agency and the Department of Health for their support during this time. I would specifically like to thank the Department of Health, which provided funding to support people sleeping on the street with no recourse to public funds. This meant that these residents were protected from contracting COVID-19 and enabled them to comply with the government guidance on shielding, self-isolation and social distancing. We need to continue this close work. The cause of a lot of chronic homelessness are health causes, addiction and mental health issues as well. Addressing these challenges will allow us to address homelessness. We must build on the last year and make this our new normal. The simple fact of the matter is that there is no single solution to homelessness. The Housing Executive has developed a chronic homelessness action plan to develop better response to deal with specific issues faced by the chronically homeless, which was launched in May 2019. The action plan sets out a range of actions to assist those who are experiencing chronic homelessness and will enable us to improve our development of services to meet the needs of the most vulnerable within our communities. Our response to the COVID-19 has highlighted the need to scale up the Housing First more rapidly. The Housing Executive have been tasked with preparing a strategic outline case for the expansion of Housing First, including additional housing supply options. My department leads on the Interdepartmental Homelessness Action Plan, which was developed in 2017 to complement the Executive's homelessness strategy. The action plan focuses on addressing gaps in non-accommodation services beyond the remit of the Housing Executive. The current Housing Executive homelessness strategy for 2017 to 22 is in its final year, and work is now commenced on the development of the next strategy for over the next 5 years. The next strategy will embrace the principles and objectives of the Reset Plan. It will set out a plan to assist the increase in diverse range of individuals who present as homeless with all of their range of needs. In terms of broader housing policies, of course the wider context of homelessness is the broader housing picture, the supply of suitable, affordable housing for households with secure tenure. And I would like to then focus on one of the most fundamental changes, increasing housing supply and options for everyone across all tenures. This is not simply about numbers, but also about ensuring there is a diverse range of options across tenures that recognise the broad variety of different household circumstances and needs. Last year, I took the Housing Amendment Act through the Assembly. This secured the ONS reclassification of housing associations back to the private sector and put the foundations in place for work to increase our housing supply. I am fully committed to building more social homes. Indeed, social housing will be at the core of my programme to tackle housing stress, reduce homelessness and increase housing supply. I've started a broad programme of work to ramp up social house building to deliver more than the current targets of around 1,900 new social build starts in 1 year. Ultimately, the scale of change required will have to involve the Housing Executive starting to build again, and I'm considering how to revitalise the Housing Executive and will bring proposals to the Executive in the next year. Of course, social housing is only one part of the whole housing system, and improving the supply of social housing will not in isolation reduce housing stress. There are other parts of our housing economy which are not working, which means that we need a wider range and choice of housing options. I want to develop other affordable housing options beyond low-cost home ownership. I will protect social housing investments by maximising the potential of newer functioning streams such as financial transactions capital loan funding. Intermediate rent is one such affordable rental product, which can deliver a new supply of affordable, good quality, well-managed homes with longer tenancies sitting between social and market rents. A key part of my ambitious programme to deliver transformative change across housing and reduce housing stress is the development of a housing supply strategy. This strategy will focus on the whole system, issues that impact on housing supply that my department cannot address without the support of other public bodies and stakeholders. It will provide the long-term basis for sustainable improvements across the entire housing market, but will have specific focus on equality and on increasing housing for those most in need. I recently launched a call for evidence to inform the development of a draft strategy, and I would like to take the opportunity to encourage response to this call. Please bring it to the attention of all you think would have an interest in shaping our future housing supply. And of course, these are long-term plans. In the meantime, many people who should be in a social housing or could have their own home are living in the private rented sector. And I have said previously that the private rented sector homes are an increasingly diverse range of households, including a growing number of households with children. I have no doubt the nature of the private rented sector is driving part of our increase in housing stress. Loss of tenure in the private rented sector is now the third highest reason for homelessness. I've committed to making the private rented sector as good a housing option as possible for those households that live in it. In the November 2020 housing statement, an ambitious programme of work was set out to improve the safety, security and quality of the private rented sector. I have recently set out the detail of that work in the department's response to the consultation on the review of the private rented sector, and my officials are currently working on the new legislative proposals, which will include a longer notice to quit period, restricting rent increases to once in any 12-month period, and restricting tenancy deposits. The bill will make it mandatory for private landlords to provide smoke alarms and carbon monoxide detectors and to carry out periodic electrical checks. There are other things we need to look at, such as letting agent regulation, the introduction of grounds for eviction and fitness standards, the role of partnership working. Finally, I would like to recognise the importance of voluntary agencies and partners in the homelessness sector. I would like to thank them for their dedication and effort, and it's vitally important that everyone involved in dealing with homelessness continues to work together. We have to ensure support is coordinated and improved for those most vulnerable within our communities. We all have seen what is possible during the lockdown, and we need to keep working in partnership in the time ahead. I set out the challenges earlier. Homelessness should be as rare as possible, as short as possible, and recur as seldom as possible. We can only do this together. So I want to thank you for the invitation to speak here today, and I wish you well for the rest of the forum.
Well, we are very grateful to Deirdre Hargey, the Minister for Communities, for recording that speech to our Impact Forum. As the Minister said, one of the features of the response to the pandemic in Northern Ireland was for housing officials to work more closely with professionals in the field of health. And that will be one of the focuses of our discussion in this session today. So I'm delighted to say that our next speaker is Professor Nigel Hart. He is a clinician. He is Associate Director for General Practice and Primary Care at Queen's University Belfast's Centre for Medical Education. So Professor Hart, Nigel, thank you.
Thanks very much, Greg, and thanks for the invitation to be part of this session today. And thanks to MLA Hargey for that presentation. I'm just going to say a couple of things just about myself. I don't purport to present myself as an expert in homelessness, but the scene behind me here, my lovely background, is actually the road where I work as a GP. As you pointed out, I am a practicing clinician. This is part of West Belfast, and my practice is just about here. And the context in which we work, I think, is important. So I work in a GP practice in an area of high deprivation. I work alongside some colleagues who work in delivering healthcare to those who are experiencing homelessness, but not directly in it. But the context, I think, is important. 37% of our population, so over 1 in 3, live in the highest quintile for deprivation for the UK as a whole. That's compared to 1 in 5 in Scotland, England, and Wales. Northern Ireland is a particular context. Many of you who will know that we had a 30-year-long period of conflict, which moved into a new phase of peacemaking in 1998. But in many ways, we're still living with the outworkings of coming out of that period of conflict. Over here, people call it the Troubles. It's colloquially known as the Troubles. 26% of our population in Northern Ireland have been affected or have a family member who's been affected in a conflict-related incident. And 15% of adults in Northern Ireland have developed mental health issues linked with their experiences of the conflict. And I guess as a GP, if I could wear that hat, what I hear, see, and am engaged in on a regular basis through my consultations are the causes of the causes. And I think that, the Minister underpinned that in her introductory video, addiction, mental health, and so on. And the whole issue of people going from those circumstances to experiencing homelessness, it's not that far away. So on a day and daily basis, and the kind of consultations we conduct with our patients, we can hear the evidence of that potential. So I'm really interested in what's happening, and the work which is happening that the Minister set out is really helpful. But we, in our place in healthcare, I think, have a role to play in identifying those who are at risk and being able to provide access to support at the time or after a period of homelessness. So I think that's all I'll probably say at this stage, Greg.
Thank you so much, Nigel, for that those introductory remarks. Now, at the Centre for Homelessness Impact, a guiding principle of our work is that although we focus on data and evidence, we are informed throughout by the voices and experiences of people who themselves have experienced homelessness. So we're very grateful that we have two representatives of DePaul, which is a cross-border charity supporting people who have experienced homelessness or who are at risk of homelessness. And so I'm going to ask Zeno Batt first, who works for DePaul, to say a little bit about DePaul, and then one of the people they've worked with, Kai, who has himself experienced homelessness, is going to tell us his story. So Zeno, over to you. Thank you.
Good morning, everyone. Thank you for having us. I'm here to represent DePaul today with a previous client of mine and somebody we're close to, which is Kai. Our company is a charity. We're based internationally, the United Kingdom, Southern Ireland, Northern Ireland, the Americas, Europe. We're very busy at the moment. We've seen a massive increase in homelessness due to the pandemic. We're struggling to sustain a lot of tenancies at the moment. We're also having a lot of problems concerning private rentals. A lot of stigma goes with our clients, unfortunately, and working with marginalised people in society is very difficult for us. We've worked with our visions, missions and values, which is one of our courses at the back. We do strive endlessly to try and end homelessness. It's very difficult and rocky road that we're on at the moment, but working closely with external agencies such as the Housing Executive and other bodies, charities, it's making the workload a little bit easier. But the pandemic has had a massive impact on us. We run services in Southern Ireland, which is a housing first model. We also do something very similar in Londonderry as well, in Derry, trying to help people sustain their tenancies within DePaul and also outside of DePaul. I'm a resettlement worker, and that's my main job and priority is to ensure that people, once they leave our services and receive the support they need, that is transferred to either other supported units or independent living, such as private tenancies and tenancies through housing associations and the housing executive. We work closely with all our clients. We have an ethos where we basically try and treat everyone as equally as possible. And working with the most marginalised people in society is very difficult. So there's a lot of fundamental problems that go with that we try to work through. I think we do an excellent job. I'm not just saying that because I work for DePaul, but in the years that I've worked for DePaul now, I've seen us grow. We're definitely increasing our outreach to people. Our flow and support is one of our most essential services. Once people move on from DePaul, we obviously try and help sustain their tenancies, and we don't leave anybody behind. We treat everybody the same. Equality is one of our main criteria for DePaul. What else is that? Gosh, I could talk for hours, to be honest with you, but I won't do. I'd like to introduce Kai as well, who was a client of ours previously, who lived within DePaul in Castle Hill. Also, he's very unique in a lot of ways, is Kai, and we've been very proud and privileged to work with Kai. He's educated us massively at Castle Hill and within DePaul in Northern Ireland, concerning the kind of person that Kai is, where he's come from, his history, and also his hopes for the future. So I'll pass you to Kai, but thank you very much. Thank you.
Hello. I'm a little bit nervous just because, as you can appreciate, it's quite hard to talk about how I become in this situation. But basically, I'm originally from Wales. I moved to Northern Ireland to be with my partner. But unfortunately, she developed an addiction to alcohol. And I found myself living in a domestic, abuse situation. And unfortunately, I'd been living like that for some time. And I just had to take myself out of the situation. I am actually a trans man, which for me added even more fear of being homeless, because I have had to come to protect myself, because you just don't know how people are going to actually respond, or, are they going to find out, or... But I actually got help from Women's Aid, which sounds strange, but they actually put me in contact with the housing executive, who were absolutely amazing, so respectful towards me. And the lady there, I don't know how, but she just kept phoning me every few days, making sure that I'd eaten, washed, all of that. But she wanted to put me into like a B&B. Now, I was too frightened, because the thing is, I'm always having to watch out. What if someone finds out that I'm trans? What if there's a shared bathroom? And I just couldn't do it. And then they offered me the place here. Now, I had actually developed PTSD from, where what had happened with my partner. And I honestly had planned to just end my life. I just wanted it over. I just couldn't go on. And if it wasn't for this place here, I would not be sat here now. Like, they have literally saved my life through laughter, through tears, through I've had every emotion possible that I could have living here. They've been so respectful. They invited me to do a talk with the staff in regards to their equality on trans issues. And I can't thank, I don't even know how to put into words how this place has saved my life. And I am now actually in social housing. I just got myself a puppy. who's driving me absolutely crazy. But I'm actually on the road to becoming a person again, because I have never in my life just felt so dehumanized, even more. Walking out of this building, across they just judge you, they just think. And the thing is, I've met so many other people here, and everyone's got such a different story, you know, and it's just really, really sad how homeless people are just looked down upon.
It's very true.
You know, so it's a horrible, and I hope one day I want to be able to get into a job, and you know, I just maybe even do a job where I can give back and help people, you know, like a job here maybe one day, you know,
Lovely.
something like that. So that's my story.
Well, Kai, on behalf of all of us, I want to say thank you so much and respect to you for telling our story. I want to hear more about your puppy. Can you tell us the name and what breed your puppy is?
He's actually a Staffy. He's called Groot after the Marvel superhero. But it's really crazy what pets can do for your mental health. You know, he's given me a routine of getting up in the morning and walking out, and it's a really funny thing because whilst I was living here, there's some feral cats, and it was really nice that Paul allowed me to look after them, and even now I still come back and give them water and biscuits. But it's mad what pets can do good for your mental health. It's really crazy how good, isn't it?
Absolutely, yeah.
Thank you. It's a very inspiring story, and it reflects well on you both, on you, Kai, and on DePaul. So thank you. We'll return to this conversation. We have one final panelist, I'm delighted to say. So she is Ruth Gray, who is clinical lead in prison dentistry at the South East Health and Social Care Trust in Northern Ireland. Ruth, thank you so much for joining us. And would you tell us a little bit about your work and the context in which you work?
Of course. Thank you, Greg. And first, I want to say thanks to Zeno and Kai there. And I just loved hearing that. And I worked for 7 years down in Dublin, and in working alongside people who were homeless in Merchants Quay, and worked really closely with DePaul Trust services and hostels. And Zeno, what you're saying, it's completely evidence-based or value-based organisation. It's fabulous. The challenge, how open it really challenges boundaries, crossing thresholds, and really creating space for people. And so I absolutely love to hear from you two there, and I've seen that evidence time and time again. So as a dentist, you may think, why am I on the panel today? But I'm a dentist with a very strong leaning towards how do we provide care for people who find it difficult to access our services, and what impact does good oral health have for people who are maybe affected by homelessness. So I spent 5 years working in Merchants Quay, which is in the centre of Dublin, and there it's a centre, a needle exchange, and a centre for people who are homeless to come and drop in and have support. And at that time, we built a multidisciplinary team of different healthcare workers to support the work of Merchants Quay. So I set up the dental service there. And within that, we really were interested not just in how people could access our services, but we really wanted to know the impact. What difference did it make if we, what difference was poor oral health having in people, but also what difference did it make whenever we could provide good care around self-esteem, around connection, around getting out of pain. We found lots of people at that time. My main interest was around people who were linking into the addiction services, especially around OST and methadone, and what difference good oral health made at those points of interjection around reducing pain and analgesia and people self-medicating because they couldn't get anywhere near a dentist. So, but then I moved up to Belfast again, that's where I'm from, and I've spent 15 years in healthcare in prison. And we work for the South Eastern Trust, so we don't work for the prison service, but we're housed within the Northern Ireland prisons. And I'm part of a multidisciplinary team, and we have health and social care within our prison. We have mental health practitioners and addiction specialists and primary care specialists. And we really function very closely as a team. And I'm the lead for dentistry, but also for our improvement work, our engagement, and our public health. And as Nigel already alluded to, you know, we have a lot of people in Northern Ireland who have experienced a high incidence of trauma. We have lots of people coming into our prisons who have experienced adverse childhood experiences, mental health illness, abuse, addictions, and because of the nature of the criminalisation of substance use, people are in and out of prison all the time, chronic illnesses. And as people enter prison, often there's a fracture of relationship. For some people, instability in housing, early school leaving, and low levels maybe of work before they come in. And as I make that list can trip off my tongue, but each of those situations is a massive experience in someone's life and shouldn't be overlooked. And so prison health, we really feel, is public health, because we have people coming in and there's a real opportunity to provide care at a point where people can access it. Well, maybe elsewhere it's really hard to get any access, or the complexity of what's going on in people's lives. So we think it's a real opportunity, and we have lots of people who come into prison and then leave prison quickly and come back in. And so that, again, that churn, and are they into hostels, are they into secure accommodation, creates a lot of complexity. So within my role, evidence base is a real key. And we want to move way beyond being a reactive service within our prison healthcare to a needs-based. And we're looking at issues around continuity of care. So as people leave or as people arrive, how do we provide the best care? We've been looking at medication pathways, including our OST, our Hep C pathways, our information sharing. But what I wanted to really focus on was how we have shifted in the last few years to become far more person-centered, and listening to the stories of people, like listening to Kai's story there is so moving. And what we have wanted to do within our service is to listen and respond. And so we spent a lot of time creating opportunities. We've used a regional survey, 10,000 Voices, which is a narrative-based survey and adapted for our prison environment, to hear the stories of people as they've arrived into prison. We've interviewed hundreds of people with the purpose and the aim of understanding their experience prior to coming into prison, how we can provide the best care as they arrive, and to keep our services transparent and accountable. And we do that work alongside our prison colleagues. And three of the big key things that have come from those interviews has been around communication, how we enable people to understand when they arrive in prison what's available, and how we can share our services. Communication and connection is our next one, around how do we connect with people, how do we create the lovely bond there with Zeno and Kai is so evident. How are we person focused and centered as we care for people? So I think that the last thing I wanted to say was just about the complexity of our systems and the multifaceted nature of homelessness. And I think Deirdre Hardy's speech there was very much about that. And I think we really need to look at pathways. This isn't just about housing. This isn't just about health. It's the complexity of those social determinants of health. And how do we create a real focus of improvement and support and connection for our services, and shifts towards community planning, collaboration across our sectors, asset-based approach in our communities. And for me, central to this is the agency of the people who are affected by homelessness and those who care for them, and have that collective agency. So I think there's great potential in what we're doing, but we need to work closer together. So I'll leave it there for the discussion, but thank you.
Well, thank you so much, Ruth, for those insights. And it's fascinating the lengths to which you went to make your services in dentistry more easily accessible. So we have a question from a member of the audience. This is posted by Colm Gallagher. And perhaps this is one for Nigel first, and then we'll come back to you, Ruth. We've heard, the question is, are there any specialist mental health homeless teams in Belfast? And are you aware if there are plans to develop these specialist teams? Nigel, do you know if that's the case?
So I'll kick off, and maybe Zeno will have some insights to this as well. So part of the strategy which the minister set out, through that there has been to set up a community homeless health service based in sort of in a community context. That's been going for, I think, about 2 years. I think it started around this time in 2019. Obviously, it was disrupted somewhat during the early stages of the pandemic, but through that service, there has it's delivered by the Belfast Trust. And because the question's about Belfast, and I know, because I have regular contact with the individual, the people who are leading that service, they have establishing very firm links with the mental health teams in the Belfast Trust, and it is progressing now. I can't say that it's a set up as a specialist team, but there is very active engagement to support the work of that community-based service for those who are experiencing homelessness, but with the expertise of the Belfast Trust healthcare team. So I think the answer is yes, but whether we regard it as a specialist team, I'm not sure, but certainly engagement from the mental health team through the homeless hub.
Thank you, Nigel. So Zeno, do you have any specialist mental health services in DePaul?
Well, we work closely with a lot of organisations. I'm based in Castle Hill, so a lot of my mental health engagement would be with the South Tyrone hospitals, via GPs, community psychiatric nurses. We don't have an actual body as such. It branches off depending on what the client's needs are. But it would be amazing if we could have a kind of a system or a collective body as such that we could access without the need to go through a lot of the processes that we have to go to in order to avail to services for our clients. So maybe that might be something for the future to talk about, something, you know, that we could put together, but it would have to be, it's not going to happen overnight, something like that. But for the moment, we continue to avail to mental health services through either GPs, hospital appointments, addiction services such as Addictions NI, Extern, Dunleary, organisations like that generally. Yeah.
Thank you. Ruth, I have a question about the prison population. As we know, there are certain groups among whom instances of homelessness are much higher, and prison leavers is absolutely one of those groups. And yet this is a relatively very small group, and we know where they are until they leave prison. Is it a source of frustration to you that much more isn't put in place to make sure that prisoners have discharge plans with somewhere to go? Isn't there? What can we and should we be doing for this group?
I think that it's really pertinent, and it's work in progress, but really needs to be focused on. At the moment, there's a lot of work done through our prison colleagues, and they have a prisoner support unit, and they will be preparing people alongside probation if probation's involved, and people as they would get released. But it's often hard to predict when someone's being released, because someone may come up and they'll have a turnaround with bail or with court, and people get released. And so as healthcare, we find it quite difficult at times to have all the ducks in a row, to make sure that the medication's right, that we have our OST ready to go. You know, there's things that within our internal processes that we're working hard on. But I think there's a real drive now, like there's a mental health strategy that's just been out for consultation. And one of the aims of that strategy was to have a transition service coming out of prison. So that's an ambition. And that would be perhaps run by our team or by others, but to really look, because how do we create these pathways where people are going into some sort of secure housing? During COVID, that was really amplified, because, you know, the amount of housing in hostels was reduced. You know, obviously there was social distancing, and we had people leaving, and we had people leaving on early release schemes as well to reduce the prison population. And it really exposed the gaps in our system to support people. And if you don't go into somewhere stable when you leave prison, you know, it's a total mountain then to try and establish yourself wherever you're going to be, to then bring some order into your life, to attend the appointments, to get your benefits. All the complex systems people have to navigate as they leave prison are made so much more difficult without permanent housing.
Yes, yeah. So you talked in your opening remarks about stigma and the stigma attached to people who experience homelessness. This and stereotypes are really big barriers in changing the conversation about homelessness. What do you think could and should be done to challenge and change the stigma that some people attach to experiencing homelessness?
Well, we definitely experience stigma with our clients and also with ourselves through our outreach, our float and support with estate agents and such. It's generally the case where once they realise where a client's coming from, it kind of changes the picture altogether. So I've been struggling quite a bit in the area that I'm in regarding finding suitable accommodation, because there seems to be this big poster that everybody carries when they're homeless, and it's something we need to get rid of. You know, we need to look at the person, not just the situation. You know, obviously the situation is important, but at the same time the person is too, and that's where a lot of our work comes from. We always strive to see the potential in people and to destigmatise when we can, because obviously we do see it in our communities. We try and tackle this with our fundraising initiatives, activities. We have been talking about doing in-house activities within our service where we would include the communities to ask them to come in and have a look at the kind of work we're doing, you know, because at the moment we're kind of seen as this building in Dungannon, you know, that's the picture that they get of us is not always the true picture. And so we are trying to push ourselves further out and destigmatise people in general, especially the marginalised clients that we work with. It's very important that we do that. And we are doing that year in, year out. And slowly but surely we'll get there eventually, I hope so.
Thank you. Kai, we have a question that's been posted for you. It's from my colleague, Hannah Green. And she says, what would you change about the system based on your experiences?
Wow. That would be a really hard thing to do. And I think, do you know the reason that is because, like, you know, homeless people, like, are just people and everyone's so individual and everyone's needs are so different. But I do think, you know, there needs to be more of a plan based around people are individuals, because I think people are just sort of getting treated all the same. And I don't think it just doesn't work, because I mean, I'm different, you know, someone else down there is different. So everyone's needs is so different. Whilst I know it's really, really hard, I think that if we can keep on it, that everyone is individual, I think that's what is going to really help. And the lack of mental health support is terrible. It is absolutely terrible. There is no support in, you know, in a way of professional. I don't mean in the way here. I just mean in that professional way. And the pandemic obviously totally changed that as well. So, I mean, I could probably talk all day about, you know, doing things, but I do think treating people as individuals and improving the mental health system for sure.
Yeah, thank you. Nigel, I have a question for you. I was very struck by Kai's description of having to share facilities when he was in given temporary shelter. And this is often a problem encountered by families with children when they're in temporary accommodation, such as a bed and breakfast or whatever. The Minister, Deirdre Hargey, said in her speech that the number of families in temporary accommodation is rising. Is this a worry for you from a clinician's perspective, that children are growing up in insecure housing when they may not feel safe, they may feel slightly threatened?
Absolutely, Greg. I mean, you know, Ruth mentioned the whole background of adverse childhood experiences. There's no question, and we see this, you know, in our interactions with families, that, you know, without you know, stable home situations, without, you know, stable access to accommodation, getting settled, being, you know, Ruth also talked about community assets, you know, becoming part of a community. I mean, without doubt, you know, those underpinning foundations have their outcome in people not really having that security, and we see that in the way the families struggle with, for children accessing schools, networks of other children being different, excluded, and those things I think just all multiply. So it is really, really important. But we see that, and I mean, as a GP, it's such a struggle, because you can see the impact of things in a sense over which you have very little control, but that is those are the foundations of stable, secure, fulfilled lives. And without those, we often are in the situation of trying to connect people with little bits and pieces of services to give support, but you sort of feel that there's a need for something much more foundational. But you try and make those connections, but it can be a struggle at times.
Yes, Ruth, you talked about trauma experienced by people in prison, by many people who are imprisoned. This is a very common thread among people who experience homelessness. Do you think that from your work that trauma is often undiagnosed or overlooked, and things that are symptoms of trauma, such as you mentioned addiction, violent behavior, disruptive behavior, are really superficial, and the problem is the trauma beneath them? Do you think that's widely understood?
I think it's not widely understood, but I think there's a movement towards understanding trauma, and within our prison healthcare, we've moved towards trauma-informed practice for the whole team. So we're not just talking mental health practitioners here, we're talking everybody with an understanding of that as a first step. We've got plenty to go from there. I feel that mental health services in community are stretched, and they're not often accessible, as Kai has mentioned there. And within the prison, we have accessible mental health services, but they're still within threshold boundaries. And in the prison, if we have people who are coming in and they have a diagnosable condition that meets the threshold, they can be seen. But within our whole population, the level of trauma and disconnect and complexity is massive. And so it's how do we start to provide care in our environment with ourselves, and even more importantly with our prison team as well, because they're the people who have the most interaction around understanding trauma. And how do we then provide some sort of environment that then starts to enable the unpicking of that trauma, which is complex. And maybe the prison environment isn't that point, or maybe it is. I think that's something that we really need to go away and have a closer look at. Our services in the prison, our mental health team, are linked to the UK Forensic Network. It's a peer review network. And so those are the sorts of complexity of issues and conversations that happen within that network. So we are evolving, but I think we've got a long way to go.
Thank you. Kai, may I ask you this, Kai? How difficult was it for you to reach out for help? Did you find it was a difficult thing to do? Did you find you were slightly embarrassed, or did you delay in seeking help?
It was really, really hard, because I didn't actually know where I was meant to turn to. I mean, obviously, being male, there is just so little out there for males that are going through domestic abuse. So I did turn to Women's Aid, because I went onto their website, and it did have a small part that says we will take calls from males. And what that phone call there, actually, I think I must have cried the whole way through, because I hadn't had anyone actually say anything nice to me in so long. But I don't think many men would actually make that call. I think the fact that I'm transgender, and that I have lived part of my life, I say as female, but obviously that's just how I was perceived, gave me the tools to know that I needed to reach out. But then still at the same time, that's probably where most of it is actually failing is people, especially men, and I mean, the majority of service users here are male. That has to say something. There has to be something that says about that. And I've spoken, to a few of the guys who have actually been in very similar situations to me and have never ever spoke to anyone else about it. So, there's something
Definitely
linked.
something there, absolutely. Yeah.
Yeah.
So Kai, if you think you described how difficult it was for you, and you think that others are in the same position, what simple things do you think that could be done to make it easier to encourage people to reach out for help?
The thing is, if you go out in the car and you listen to the radio, or you go out and you see a poster, those type of situations, and I can only speak about myself and my situation, it's all addressed to women. So, it almost stigmatizes. It's as if, well, this shouldn't then be happening to me, or I should be strong enough to deal with this. I should be, and not just that, it's all about education. Do you know that even some of my friends that I have known for 10 years, I tried to reach out, and one of them responded to me in saying that, but that's just females, they're emotional, that's just, and excuse me for my language, but that is just a very shitty response. Nobody should be living with abuse, whether you're male, female, whether you're non-binary, nobody should be living in that. So I think it's all about education and awareness. That is the key, is letting people know that, it doesn't matter what your gender is, this situation isn't okay, and it's okay to reach out for help.
Yes, thank you. Nigel, can I ask you about access to services? We sometimes hear, I'm not talking about your practice here, but more generally in what you see, sometimes institutions can label individuals as hard to reach when it could be that their services are hard to access. Do you think enough is done by, for example, GP practices or other primary care services to make themselves accessible?
I think that the simple answer to that, Greg, is that that I think all services can look at how they provide access to all sorts of groups, and I agree with you. The label of hard to reach isn't always helpful, but I think the starting point for that has to start with understanding those groups who are finding it difficult to access services. And I think certainly, one of the things that, as we have been emerging from the pandemic, is the rise in general demand and our capacity to manage it, and the increased complexity of demand. I'm talking about across the whole, all of those trying to access our service, which is the one I can speak about with real experience. But we can see the evidence of that on a daily basis as the demand rises, and we struggle to provide just general access. And then you can come into specific groups. And certainly people experiencing homelessness is one of those. As our good colleague, Austin O'Carroll, spoke at our seminar a few weeks ago, if you were wanting to meet the needs of people experiencing homelessness in terms of healthcare, you would if you want to make it difficult, you would have a form to fill in, and you make the form really, really long and difficult. And I think that's true. I think we have traditionally designed services around a certain expectation, and I think we continually need to look at that, understanding who it is we're not providing the service for, and understanding how we can make sure that becomes as easy as possible. I think it's a perpetual job that we have to attend to.
Thank you so much. We have a question posted by Kelly McLaughlin, and she asks, can anyone let me know how people self-refer or members of the public refer someone who is experiencing street homelessness? And she says, in London, we use StreetLink, which is an app or phone line. Do you have anything similar in Northern Ireland? Perhaps, Zeno, do you know if there's anything like this app called StreetLink that is used?
Yeah, I think there was, I recall a good while back about some kind of app that the people could use on the phones. I don't know how far that development went, to be honest with you. Generally, my referrals will come from the mental health services, hospitals, GPs, housing executive, social workers, generally referrals. But yeah, I do recall hearing about an app once that people could use to access the kind of services that we offer at DePaul, but I'm not sure. You kind of caught me out with that one. I'm not sure how far that's gone, to be honest. I'm kind of more a hands-on, reaching out and finding people, but I'm sure there's something out there, and if there isn't, then it would be an excellent idea to have one, absolutely.
And just very briefly, we've had a question in the chat about reforms to the housing executive. What are your hopes for the reforms to the housing executive? This question posed. Do any of you have anything you feel you can say about reforms to the housing executive? Maybe that's one for another time. But as we come to a close, more broadly, our vision at the Centre for Homelessness Impact is to end homelessness. We think this can be achieved. And I wonder if I can ask each of you in turn if you think that's realistic, if you are optimistic that we can end homelessness, for example, within a decade. Perhaps, Zeno, can I ask you that question first?
That's probably a very good question, and that's our main aim, is to end homelessness. But at the moment, and until the housing reform continues the way it's going, I understand the housing executive at the moment have made a new kind of legislation or something regarding people accessing homelessness services and such. I think for now it's unlikely we will end homelessness. But at the same time, if we all work together collectively, we can certainly soften the impacts that this would have on people. But ideally, it would be lovely to turn around and say to you in 10 years' time, homelessness will end. But I'm optimistic. I'm not put off, but at the same time, I have to be realistic as well and consider that it seems to be at the moment ingrained in society, homelessness. It's kind of the fabric at the moment, but hopefully we can change things. I'm optimistic.
Kai, do you have a view? Can we end homelessness? Is it realistic?
I don't think so. I think there seems to be less and less social housing, more and more private accommodation. I don't think private works, especially for people like myself. I mean, you know, it just doesn't. I don't think so. I'm sorry, no.
Fair enough, Kai. You can only tell it like you see it. Ruth, can I ask you the same question?
I'm a big optimist, so I'd really love to say yes, but I think it would take really brave leadership, not just around housing. It would be about community planning. It's definitely about resources, investment in, as we've mentioned, mental health services, addictions, but way bigger than that. How do we enable our communities? And how do we create a sense of belonging within our communities? So these are hard to put down in strategies. These are big shifts in how we interact and care for each other. So I don't know if we can do that in 10 years, but I think we've got to start. And you know, services like DePaul are modelling how we care for each other. So I'm going to say tentatively yes, but there's a lot of complexity behind that.
Thank you. And finally, Nigel, it's for you.
Okay. Like Ruth, I'm an optimist, and I believe that we should apply ourselves to that very much. At my opening, I talked about the causes of the causes, and I think as well as community, as Ruth has alluded to, we in all services do meet people at points of crisis, and I think there's things that we can do to intervene, you know, to prevent further move towards homelessness. So I think that we can get upstream, but it is complex, but we've got to work together. And so I think, being an optimist, then I think we should apply ourselves to that.
Well, thank you so much. Thank you to our audience for watching, and for our panel, Nigel Hart, Ruth Gray, Zeno Blatt, and particularly to you, Kai. It's not easy to talk about these things, but it's so important we do hear the voice of people who've experienced homelessness. The next session of our Impact Forum is at 1:30, when we'll have the view from Wales, and we're delighted that Julie James, the Minister for Climate Change, who's in charge of housing policy, will join us there. So thank you very much for joining our Impact Forum 2021.
Thank you for having us.
Thank
Absolute
you.
pleasure.